Hi, welcome into the clinic. Do you have an appointment for today? Okay, let's see. What's your name? Okay, I see you right here. 2 o'clock, perfect. And what can I help you with today? Okay. So you have a couple moles that you want to get checked? Okay, perfect. And where are these moles? On your arm? Okay. And are these, have you had these moles for a long time, or did they just appear recently? Okay. So one you've had for a while, but it's changing shape a little bit, and then one just appeared. Okay. When did you notice it? Okay. Well, it's great that you're coming in to get these checked. Can you go ahead and roll up your sleeve for me? Okay, very good. Well, we can get started now. I'm gonna put on some gloves and take a look at those, okay? Now, do you wear sunscreen, SPF? You do, okay, good. Okay, let's take a look at that. Okay, see, is this the one that is new or the one that grew? This one right here. Okay, so that's the one that's new. Okay, let's take a look. I'm actually gonna feel around it a little bit. Okay, and then I'm gonna measure. Okay, so it's about 1, 2, 3, 1/4 of an inch. Okay. And then, is it this one right here? Okay, let's see. So it was smaller before, or it, okay. It was more flat to the skin. Okay, I'm gonna go ahead and measure that one as well. Yeah, that one is a little bit bigger. And it's also measuring out from the skin. Okay. It is also kind of jagged, meaning it's not just a smooth, rounded shape, but it's got kind of irregular. If you don't mind, I'm just going to examine the rest of your arm. I'm just going to take this little baby flashlight and kind of just see with my flashlight. Okay. And then can I see your other arm as well? Okay, I don't see anything on that side, so that's good. Have you been experiencing any discomfort or pain? No. Okay, good. Okay. Let me go ahead and measure this one again. to see if it's raised out significantly. Okay. So, I do think that it is worth getting a biopsy of this one up here, just the way that it's changed shape and come outward. So I do think that we could do a biopsy. If you want, we could schedule the biopsy for right now. You want to do that? Okay, so we'll do biopsy of that one. We can also biopsy the other one just while we're here. Okay. Very good. So I'm just gonna get a few things ready. I'll have you stay here with me for a second, and then we can begin the procedure, okay? Okay, so what we're gonna do, I'm gonna go ahead and numb you up, just localized anesthesia. So you're gonna be awake. It's gonna take a minute, probably tops, to do both moles. I'm going to, after I numb you up, I'm going to use my little scalpel, just looks like this, and we're going to just remove the top layer of the mole. So I'm not gonna like dig into your skin, I'm just going to kind of flatten the area. We're going to put them in a bottle or a container, and we're gonna take that to get biopsied, okay? Okay, very good. So I'm just going to make a few more notes. So let's go ahead and start by cleaning your skin off. I'm just going to spray some antiseptic onto a cleansing pad, and I'm going to just clean the area, okay? Localized anesthesia. So I'm just going to have you sit still for me if you want to take a few deep breaths in, or if you're fine with needles. Okay, so I'm gonna go ahead and put it just right under where the first mole is, and we're just going to enter, and I'm going to just put a little bit of that anesthesia in. Okay, get that into the skin, and because of the placement of the moles, I'm going to do another little bit up here because it's a little farther away, so I want to make sure that both spots have enough anesthesia so that you're comfortable. Okay, so we're just going to inject right here. Evenly distribute that through the area. So if you want, we can do a little test just to make sure that it's setting in. So I'm gonna go ahead and have you close your eyes, and I'm going to poke you, and I want you to tell me if you feel it, okay? Okay, so ready? Did you feel any of that? No? Okay, very good. Then we can begin. I'm going to take my scalpel, and I'm just going to begin by cutting up, just slicing right here. Okay, and then underneath. Okay, before that comes off, I'm going to get my bottle, and I'm just going to drop it into the sample cup. Okay, and then there's a little bit of blood, but we're just going to wipe that off. It's not too bad. Okay, let's do the other one now. Up here, I'm just going to. Okay, take the cup. Okay, that was easy. See, I told you it wouldn't take very long. It's the easiest part of this. I'm just gonna clean that off. I'm going to close up our sample, and we will take this to the lab. Okay. And I'm gonna go ahead and bandage up your arm because we don't want anything exposed to this area, okay? So I'm gonna go ahead and wrap this around the area. Both sides. And make sure that that's on very nice. Okay, very good. So yeah, don't get the area wet for the, I guess, next 24 hours. Tomorrow you can take a shower and clean the area off. But again, I just don't want that area exposed, okay? So what we're gonna do is we're gonna take the sample in, we're gonna biopsy that, and then we will call you with the results in the next week, okay? Okay, yeah. It was great that you came in and got that done. It's better to be proactive than reactive, right? Okay. Well, I wish you all the best and hope that you have good news coming soon, okay? Okay. Bye.